Okay. Good morning, colleagues. Good morning, those who are joining us online. We have about 74 colleagues joining, and hopefully we'll have more registered for this webinar. Very happy to have you here. My name is Karina Tkanavoj. I am the Regional Advisor for Alcohol, Illicit Drugs and Prison Health in WHO Regional Office for Europe. And I welcome all of you as well as our distinct panelists who are joining us today. Without further ado, let me just give you a little bit of insights into what we are doing here. I think you know that in May 2023, we have launched a training course on alcohol and public health in Europe. And the aim was to establish a network of early career researchers working on alcohol from a public health perspective. So this has been the major component and a major step as well to link early career researchers with the direct implementation of our grants, which is linked to a project, a WHO and European Commission project linking evidence into action called Evid Action Project. And this aims to bringing scientific evidence to promote and support implementation of effective alcohol policies to the communities in the EU, Iceland, Norway, and Ukraine. So this course is a huge response. We had a huge response to this course, and the program has received a lot of applications. I think we had about, I don't remember, but I think more than 500 applications. And unfortunately, we had to select only a few of you, and we have been already in a first meeting very recently, where we had the opportunity to discuss with those that have been selected also what the program will look like in terms of the network and what are the expectations. So given the high profile of the invited speakers today and also the relevance of the topics, we decided to have this online events so that we could have also the opportunity, give the opportunity for those who could not initially join the course in present, but could also be publicly available in the form of webinars so that all of you can have access to the knowledge, to the research, and also to the latest findings that we are going to present here. So these webinars, and it's a series of 6 webinars, are bringing together some of the best people in the field as speakers, and they're going to discuss here the key evidence and the most recent findings, also relevant for the Evid Action Project, as I already mentioned. We see this webinar series also as our contribution to building a community of practice that will translate evidence into action and also raise awareness for alcohol in the European Union and also beyond. So with this, I'm very happy to be joined here with, first of all, welcome. It's really good that we could connect. And to Robin, very mindful of the time, I will give you the floor for your presentation. Please go ahead.
Thank you. Thank you very much. Okay, so I'm going to plunge right in. Next slide, please. First of all, let me talk about at the global intergovernmental level. This is around, which is what we've begun talking about just there. Next slide, please. The WHO adopted a global strategy to reduce the harmful use of alcohol in 2010, and it recommended 10 target areas for policy measures and interventions. And you'll see 3 of them there. We put in red: availability of alcohol, the marketing of alcoholic beverages, and pricing policies. And these are the issues that that we've been focusing on. What the WHO, after that time, a few years later, decided were the best buy interventions for intervening in the alcohol market. That strategy, the WHO, let's go to the next slide, please. The WHO looked at that strategy and has been trying to apply it. The findings of the consultative process on implementing the global strategy in the about a couple of years ago now, were that the problems were very complex. There were mixed messages. It was an increasing concentration of alcohol production and of the alcohol industry. And of course, there are no international, as I'll talk about a bit more, and no international legally binding regulatory instruments, unlike for tobacco or for the drugs that are covered by the drug conventions. There are, on the other hand, opportunities because there are increased recognition in general populations. I think that alcohol is a factor in health and social inequalities, certainly in the research literature and among professionals. Alcohol has to be taken into account, and the availability of alcohol should be taken into account in the context of the Sustainable Development Goals, which the United Nations is pursuing. Another opportunity is the fact that particularly in richer countries, there's been a decline in drinking among teenagers and now among those in their 20s as a result of increased awareness of health harm and the scaling up of screening and brief intervention policies and health literacy. There's strong evidence on the cost effectiveness of alcohol policies, which we've been hearing about now. So let's go on to the next slide. The findings of the consultative process were that these areas that we've been talking about and some other related areas were priority areas for strengthening the implementation of the global strategy. And this was adopted by the World Health Assembly in 2020 to establish broad partnership and collaborative network at all levels, and to continue to implement the global actions in the global strategy. On to the next one. Why we need a stronger global governance of alcohol? Well, alcohol is a significant global health agenda with little progress in implementation of the 2010 global strategy. As we've been talking about, the alcohol damages are substantial to the drinker's health, to others around the drinker, and to society and socioeconomics. Some alcohol-related problems cross borders, as we've been beginning to talk about with digital marketing, industry interference, which is often cross-border, and free trade negotiations. And while tobacco control has made great progress since the implementation of the Framework Convention on Tobacco Control in 2003, as I've already mentioned, alcohol is the only widely used psychoactive substance not covered by any international control oriented to public health and welfare interests. It is covered by controls of whether you can call something champagne if it's not from that district, and other kinds of things that help the industry or help sections of the industry, but nothing that has to do with public health and welfare interests. Next slide, please. So alcohol is a psychoactive substance that produces its psychoactive effects through known neurobiological mechanisms. It's a toxic substance that has significant toxic effects on tissues and organs in living organisms, in fact, in a number of different parts of the body. It's a teratogenic substance known to cause congenital abnormalities in fetal alcohol syndrome, and it's involved in the causing of cancer for about half a dozen kinds of cancer. And it's also a substance, as I don't have to tell anyone, that people can become dependent on. Onward. Next slide, please. It adversely affects health in many ways, both from heavy drinking occasions and from the total volume consumed. And on the right, you can see the list of harms to the drinker this is talking about, really. Onward. Next slide, please. Here are some risk relations with the burden of disease overall. As you can see, the more drinks are being drunk on average in the population, the more the harm goes up. To determine the causality of such positive effects, of any positive effects, you need to really, basically, we've now reached this conclusion that there are no, in the population as a whole, the net effect at any level of drinking is negative, although it's quite small for people who are drinking small amounts. Onward. Next slide, please. So alcohol is not only pervasive, but it's also very complicated. This is a slide that I won't spend much time on, but these are the number of disability-adjusted life years that are, this is from a calculation a little over 10 years ago, but the general pattern hasn't changed. You can see that it looks like a field marshal's ribbon, the alcohol use one, the fifth one down, with all of the different diseases that are associated or disorders that are associated and can be made worse or caused by alcohol. You'll see that the second last of these ribbons is illicit drug use, essentially. And it's much smaller on a global basis. Onward, next slide, please. The distribution of disability-adjusted life years, that is the measure that's being used, that's not only about deaths, but that are premature deaths, but also about your quality of life being adversely affected. As you can see, here's another way of showing the different kinds of diseases which alcohol has the responsibility for as a partial cause of. Unintentional injuries, as you can see over there on the left, is a very substantial one. Intentional injuries is another 10% or so. We don't usually in rich countries talk about alcohol and infectious diseases, but that's quite important in poor countries. Onward, next slide, please. But the thing about alcohol is that there's social as well as health harm, and it happens to others as well as to the drinker. And this is a set of psychopharmacologists that were called together for a multi-criteria decision analysis. And you can see along the bottom there are different kinds of drugs, with alcohol on the left, heroin next, and crack cocaine next. And the red part of these columns is the part of the harm to others than the person using the drug. And you can see for their estimation was that the harm to others was actually larger for alcohol than the harm to the drinker themselves. And you can see that that's counting 7 types of harm to others: injury and crime and environmental damage and family adversities, international damage, economic cost, and community harm. That's been done repeated in other, that was done in Europe, but it's been repeated in other contexts as well. It's give us all cause to think. On to the next, please. Here are ratings on 4 dimensions of a bunch of different drugs, with alcohol at the bottom. The safety ratio is what's the relationship between the lethal dose and the usual dose. And for alcohol, for the usual oral dose of alcohol, then if you drink 10 times as much, then you're likely to die. And as you can see, that's a pretty close ratio compared with the ratio for MDMA and ecstasy or cocaine. Heroin is more, intravenous heroin is got a more lethal to usual, a smaller ratio. In other words, it's closer to the ordinary person who is using heroines and injecting it intravenously only has to do 6 times as much, and they are likely to die. For intoxicating effect, among 6 different drugs that Hiltz ranked, it was the highest. In general toxicity, this is from a French committee in 1999. They got a little bit of political trouble over their report, the Roques committee, and they said that the general toxicity of alcohol was strong compared with other drugs, and the social dangerousness was strong compared with other drugs. Onward. Next slide, please. So Here's the global status report on alcohol and health that WHO issued in 2018. WHO issues these reports every few years, and I think that's still the most recent one. There's one coming fairly soon, I think, and Jürgen can tell us more about when. Basically, it's a long sentence that tells you that there's a strong public health case for considering the negotiation of a framework convention on alcohol control, or alternatively for including alcohol within other international control systems, such as the drug control system, as has been presented and discussed by public health entities and advocates. And you can see, you can find that report if you want to see it. It's a big fat report that you can find on the web very easily by going and looking under who.int. And I think Maria just gave you a note about it. On to the next one, please. Next slide. Why would a treaty matter for alcohol control? It's symbolic in the longer term as well as pragmatic in terms of its more immediate importance. It says, wait a minute, this is something which has substantial harm, not only to the drinker, but also often to people around the drinker. It brings institutional commitment and staffing at the international level. WHO, there's a kind of partner agency to WHO, which is the Tobacco Control Agency under the Framework Convention on Tobacco Control. And it has scores of staff members, whereas WHO has, depending on where you look at it, and people who are on this can probably give you a better sense of it, but it has more than the few than can be counted on 10 fingers if you look across all of the WHO sites in the world, but that's about it. It's quite small. Expectations of comity so that one nation doesn't undercut another's control measures, which you can see has happened quite often with alcohol. Coordination to counter the power of the multinationals. They often know a great deal more about what's happening in the world than a national government or its alcohol control agencies know. And it's also a way of countering, we can see from looking at the documents and the proceedings of the World Trade Organization agencies, committees, that having a treaty counters international pressures to increase availability through the trade treaties. On next slide, please. But as of now, attention by WHO and other global agencies is dwarfed by the magnitude of the alcohol issues. There's the role of vested interests in lobbying against attention and resources. There's the challenge of the multi-sectoral nature of alcohol problems. Even within WHO, different pieces of WHO have a little piece of the puzzle. Non-communicable diseases, traffic accidents and injuries and so forth. They're spread across WHO headquarters in terms of where they're located in the organization. I looked at what other global agencies have done on alcohol issues, and if they do take an interest, first of all, they very often call on WHO and do something jointly. Secondly, it lasts about 3 years or 5 years, and then it's gone. WHO has even though the history in WHO is somewhat mixed, it's had a more continuing concern. The other thing that's worth mentioning is the cultural position of alcohol, that for the affluent, it's our drug. If you look at the consumption of alcohol in not only in poor countries, but in rich countries, it's much more being drunk. The consumption tends to be relatively high in terms of the amount of consumption for those who are affluent, even though the harm per liter of alcohol is much greater for the poor. It's an international symbol of luxury and of celebration for elites. If you go to a reception even at the World Health Organization, then there'll be alcohol served at some kind of diplomatic reception. there'd been discussions going on at WHO for quite a long time about whether alcohol should be available at lunchtime in the cafeteria in Geneva. So this reflects that cultural position of alcohol as something that relatively well-off people and the people who make political decisions feel is their drug, essentially. So the global governance response is that WHO has responded, but it has limited resources to respond, and other global agencies, it's almost non-existent. Onward, next slide. Now I'm turning to the national level, controlling the market of alcohol in a national country. There are two main means of control. One is by licensing people to produce or sell alcoholic beverages with an alcohol licensing system and some kind of means of enforcing it. And the other is by a state monopoly of all or part of the production and sale. The monopoly can be applied at production levels in terms of who's producing the alcohol, at the wholesale level, and at the retail level. And at the retail level, there's a separation between, in alcohol, we talk about on sale and off sale. On sale meaning where you drink it at that place with your dinner or in a tavern, and off sale is where it's sold by the bottle or can to be taken away. In the European Union, monopoly at the retail level is okay, although the Nordic countries had to fight fairly strongly around that when they joined the European Union. But the wholesale and the import levels are questioned, and the wholesale monopoly disappeared in Sweden and Finland. And it's also true that the EU insists that domestic imported goods be treated equally. Onward, please. Next slide. Historically, alcohol monopolies were common, but not always in the interest of public health. They were a source of revenue and control for empires. There were opium monopolies and tobacco monopolies as well, with that kind of idea in mind. They were part of state ownership under communism. They were an alternative to prohibition in societies with a strong temperance movement history, however, where people turned away to what would now be called harm reduction rather than banning alcohol. The way that was often done in North America and in Northern Europe was with a government monopoly to control the market. In the US, there are 17 what they call control states, 13 of which run a retail monopoly in spirits and wine, or just spirits, and 12 of the 13 Canadian provinces and territories have retail monopoly stores. But if you're going to worry about and be concerned about public health and welfare, then the revenue goal should be constrained. And so one of the things we can learn very quickly by looking at the history is locate the monopoly under a health or welfare ministry in the government, not under the finance ministry. Onward, next, please. There has, in this neoliberal age, has been a lot of pressure to weaken monopolies, both in North America and in Northern Europe. And that's currently going on, as I understand it, in Finland, the pressures about that. In that kind of circumstance, the US government's Centers for Disease Control and Prevention called together a systematic review of what were the effects of alcohol retail privatization on excessive alcohol consumption and related harms. Then they put together the results from 17 studies of privatization in North America and one in Finland. Some of the changes studied are of privatizing retail sale of wine, but not spirits. So it's a mixed bag of what the particular studies that they, particular measures that have been taken. Next slide, please. They found that basically the median effect of privatization on consumption of privatized beverages was 44%. And for the non-privatized beverages, that was beer in North America, for instance, which were already private, it reduced it by 2%. In other words, they had a little offset. So that's supposed to be a minus 2.2. The minus is on a different line from the 2.2. I'm sorry. There's strong evidence that retail privatization of alcohol sales leads to increases in excessive alcohol consumption, was their conclusion. Next slide, please. So there are public health and welfare advantages of alcohol monopolies, and I've listed them here in terms of limits on availability, public health interests in selection and pricing. For instance, there was, before it was called that, there was minimum unit price in the Canadian monopolies. Conditions of sale, less point of sale promotion, and that they adhere to the conditions of sale under the rules that are set forward by the government. And what in the 100 years ago they were talking about as disinterested management, that is management which didn't get a percentage of whatever it sold, which is what very often happens with private enterprise. And I couldn't resist putting in the quote from John D. Rockefeller, who you don't think of very often as someone in favor of government control of the market, but he was with respect to alcohol. Only as the profit motive is eliminated is there any hope of controlling the liquor traffic in the interests of a different society. A decent society was his conclusion in 1933. And it's also true that if, I've worked in alcohol research for my whole career, and basically the strongest places for alcohol problems research tended to be the monopoly places like Finland and Ontario in Canada and so forth. So interest in and support for alcohol harm reduction research. That's a small thing around the edge. Onward. Next slide, please. So there are, on the other hand, arguments and interests against monopolies. Private interests, obviously, pushing not only at national and subnational levels, but also in trade agreements and disputes. Ideological opposition, the neoliberal small state argument, what's the government doing getting so large? A commitment to prohibition rather than control. The temperance, many people in the temperance movements historically were very much opposed to what we would now call harm reduction. Moral opposition or unease about the government dirtying its hand with a problematic business, which I think you can see in the North American debates often. So it's not an easy path, but it is a plus for health and welfare. So then what I have at the bottom is that I was supposed to come first and we were supposed to go on to Ingeborg. And so that's the end. Thank you.
So Ingeborg, thank you for joining us. It is really a great pleasure to have you here. And I give you the floor for introduction and for your presentation. Thank you very much.
I'm going to talk about restrictions on alcohol marketing today. And by marketing, we mean not only advertising of alcohol, but also all sorts of sales promotion. I'll talk about what kinds of restrictions we have in Europe today, and then I'll talk about the overall evidence on what we have about restrictions on marketing. And finally, I will give you an example of what happened in Norway specifically. Next slide, please. Now, this slide gives you an overview of marketing restrictions in European countries. So among all the 53 member states of the WHO European region, we can see the number of member states with marketing bans pertaining to various kinds of ether media and other kinds of media and by beverage. So what you can see in the column two or the bars to the left are the number of countries with bans on marketing of alcohol on national TV. Then it's local TV, national radio, local radio, print media. Then it's billboards, and it's point of sale, cinema, internet, and social media at the end. And so what you can see is that there are more countries with bans on marketing with regard to TV and radio than, for instance, with regard to internet and social media. And the blue bars are for spirits, the red bars are for wine, and the orange or yellow bars are for beer. So you can see that there are more countries that have restrictions on spirits, marketing bans with regard to spirits than with regard to beer and wine. Next, please. So this shows a kind of the mirror or the opposite part, because it shows the number of countries in the WHO European region without any marketing regulations. So there are very few countries with no marketing regulations on TV, whereas a much larger number of countries have no marketing regulations on the internet and on social media. And in fact, there are very few countries in the European region that do not have any kind of marketing restrictions at all. Next, please. So across Europe, there are substantial variations with regard to restrictions on marketing. And as you've seen, these restrictions, they vary by medium, including the social media. And not only that, but they also vary with regard to timing. So there may be bans with regard to when marketing can or advertising can be sent on TV, for instance. Also with regard, there are also restrictions with regard to content, which may vary, and also the place, for instance, where billboards can be allowed. And as we've already seen, there are restrictions. They vary with regard to beverage strength, or they vary by spirits, wine, and beer. There is also a variation with regard to monitoring and enforcement. So whether it's statutory bodies or self-regulation with regard to monitoring and enforcement vary across the countries. And there are also there's also variation with regard to whether breakages are or sanctions are in terms of fines or revocation of sales license. Next, please. So the WHO has stated for instance, in the SAFER initiative, that bans and comprehensive restrictions on alcohol advertising, sponsorship and promotion are impactful and cost-effective measures. And they are one out of the 5 best buys, that means most cost-effective priority interventions to prevent alcohol harms. Next, please. In the book Alcohol, No Ordinary Commodity, the 3rd edition that came out earlier this year, we have rated the various interventions and strategies to prevent alcohol harms. And with regard to marketing, we have stated that a complete ban is moderately effective. That means we've given it 2 pluses, which is in the intermediate range. It's not the best, but it's moderately effective. And we've given it 2 pluses with regard to the breadth of research support. And the reason for this is that there are, in fact, quite few studies in this area, and most of the evidence is indirect, and I'll come back to this. With regard to partial bans, these are assumed to be less effective, and the breadth of research support is also weaker. And there are also varying types of marketing and reach of ban. With regard to co-regulation and voluntary self-regulation, we don't really have any research on impact on these. Next, please. So the conclusion in the book Alcohol, No Ordinary Commodity is that best practice is a complete ban on marketing. A good practice would be partial ban on alcohol marketing, and ineffective or potentially harmful practices, industry voluntary self-regulation of marketing. Next, please. So what is the evidence behind these recommendations? Well, first of all, there is broad literature which suggests a causal effect of alcohol marketing on drinking among young people. And you can see some of the reference literature here. And if you would like the complete references, please let me know afterwards. Next, please. When it comes to the literature on the effects of restrictions on marketing, the evidence is much smaller. Less is known about the effects of restrictions on marketing with regard to partial restrictions. Here, the evidence is actually mixed. One study by Safra and Dave from 2002 found that across a number of countries, they found evidence of an effect on per capita consumption from partial restrictions, whereas John Nelson's study from 2010 found no effect of partial restrictions. There are a number of comments with regard to both these studies, and if you'd like me to get through that, we can discuss that afterwards. As for comprehensive bans on marketing, there are some countries where such bans have occurred fairly recently, but they occurred along with other policy changes. So it's been difficult to disentangle the single effect of the comprehensive ban. However, in Norway, there was a ban in 1975, and this has been studied recently, and I will talk more about that in a few minutes. Next, please. Finally, what we also draw upon is the evidence from tobacco marketing bans. And here it is well demonstrated that comprehensive bans do have an effect on tobacco consumption. So what we are assuming that there are lessons to be drawn from tobacco marketing bans as well. Next, please. Now to the Norwegian case, which is a comprehensive ban on alcohol marketing. The ban applies to all kinds of advertising and marketing of alcohol in all media, with some very tiny exceptions, and for all kinds of alcoholic beverages above 2.5%. This ban took effect in 1975, and in 1997, this ban was extended to include also brands for which there are also products with alcohol content above 2.5%. So, for instance, if there is a brand with that produces both non-alcoholic beer and also beer with an alcohol content of 4.5%, which is very common in Norway, this brand cannot promote or advertise for its non-alcoholic beer. And the same pertains also to marketing of clothes or other kinds of commodities with a brand which is for an alcohol product above 2.5%. Next, please. The reason why this ban took effect in 1975 was mostly that there was a deep concern over advertising effects on young people. There was not much research literature at that time about the effects of advertising on young people. So that literature has come afterwards, but there was still a strong concern which led to the legislation change in 1975. It's also important to note that this ban is part of a very comprehensive restrictive alcohol policy in Norway, which includes high alcohol taxes. We have a state monopoly on sales of off-premise wine and spirit sales. We have fairly severe restrictions on trading days and trading hours, and of course there's also an age limit for purchase of alcohol on-premise and off-premise, 20 years for spirits and 18 years for beer and wine. And it's also important to note that there was a similar comprehensive ban on tobacco marketing, which also occurred in 1975. Next, please. The enforcement of this ban is at the national level is it lies with the Norwegian Directorate of Health, and the sanctions are compulsory fines. At the local level, the municipality authority is the legal body to monitor and enforce the ban, and the authorities can revoke sales license as a sanction if the ban is breached. The challenge here is mainly with regard to marketing and social media, and I'll mention that again a little bit in the further. Next, please. What was the effect of this ban in 1975? A fairly recent study by me showed that there was in fact an impact on alcohol sales in Norway. This curve it gives you the total alcohol sales in Norway from 1960 to 2005, and you can see that what happened after 1975, it was not a dramatic immediate change in alcohol sales. So the alcohol sales were not dramatically and anonymously impacted by the alcohol sales, but by running a time series, interrupted time series analysis, and controlling also for prices and wages, affordability of alcohol. I found an immediate and lasting effect of the ban, and so the sales went down by 7.4%. And that's a quite substantial decrease in sales from only one regulation, and it's actually larger than what was found, for instance, with regard to the ban on Saturday alcohol sales in Sweden for a number of years. Next, please. A little bit now about loopholes and circumvention of the ban in Norway. One loophole, so to speak, is that editorial articles and columns about alcohol are not included or covered by the marketing ban. So journalists are free to write about or talk about alcohol and make even recommendations about wines or spirits or beer or whatever they would like. And that's actually what is happening. Also, I think almost all print media or all newspapers in Norway have a regular column with wine journalism. And one study showed also that these columns and articles, when they recommend a specific brand of wine, particularly, people tend to buy more of this particular brand. So it has an impact on sales. With regard to social media, although the ban includes also social media, it seems that social media are used for marketing to an increasing its extent, and that In various ways, the ban is circumvented on social media, but we still need to know more about what is happening on social media in this regard. And that completes my presentation about marketing restrictions. And now over to you, Jürgen.
Thanks a lot. I've tried to answer some of the background because we were a little bit scrambled because the originally thought about order was changed. Anyway, I will talk about taxation as an alcohol control measure. And again, my remarks will be based on the book Alcohol No Ordinary Commodity. If you look into your chat, you see that the copy of the book is available there. I've also given the link for people to download it later. Next slide, please. So basically, why do we speak about taxation? Well, first of all, it's one of the 3 best buys. It's one of the 5 safer measures which Ingeborg has been alluding to. But it's also more important for the simple reason that it's less implemented in Europe. You see Norway. And if you look at the map on my graph, you see that Norway is one of the few countries which have overall also high taxation, but that's an exception. Look at the rest of WHO European Union, not European Union, but European region, of course. And you see very clearly, it's all in a very, very light yellow, meaning that taxation is the least implemented. We do have a tax share for some of the alcoholic drinks, for example, for wine, which is under 10%, meaning whenever you buy a bottle of wine in WHO European region, less than 10% of the sales price go to the state. And it's a little bit better for beer, but not good. And it's a little bit better for spirits. But overall, most countries really do not use taxation. This is in stark contrast to tobacco, where whenever you buy a pack of tobacco, 75% of the price will actually go into the coffers of the state. So next slide, please. And this is a graph on affordability. It is clearly showing that alcohol is very affordable. And the countries who have the highest rate of affordability are Germany, Luxembourg, Czech Republic, Slovakia, and Austria, meaning the central of the European Union. And you basically see that is the result of basically the taxes not being increased for years. And if they were increased to way less than the inflation rate or the disposable income. So alcohol became more and more affordable. That means a normal worker had to work less minutes to buy 1 bottle of beer in almost all of those countries. And that is part of the problem. Next slide, please. This is the book. We have already talked about it in the chat. There, you can download it yourself. You can also buy a copy, but the download is free. And there's a summary article in addiction, and there are currently quite a number of translations in progress. I know of 6 for sure, but we are probably ending up with more than 10 different translations of the book. Next slide, please. Why do you, what is the underlying idea behind taxation? Well, taxation is part of the normal economic processes. And the normal economic theory stipulates that goods which cause problems which cause costs to society should be taxed, especially with an excise tax to cover those what economics call negative externalities. Now, if you increase those taxes, the price will be increasing if you assume that there is a pass-through and industry is actually putting the taxation increase to the consumer. The good becomes more expensive, and very simply, whatever becomes more expensive is less bought. And this is basically the underlying theory behind it. Next slide, please. Next slide. Here, these are the ratings from ANOC. There is alcohol taxes has an effectiveness triple+ and a breadth of research support also triple+. Of course, there are exceptions. There's an exception of a study that tobacco doesn't lead to cancer. This is normal statistics. If you have 100 studies, there may be the odd study, 1 or 2, which does not work, but taxes do work. And in reality, of course, tobacco leads to lung cancer. So the research support is very good. We have more than 180 studies on that. And whenever taxes are increased, consumption is going down. Other financial measures, the minimum unit price is also effective, but has way less research support. We are currently working to increase this research support, and some of the later findings, for example, the stuff which has been published in the Lancet about Scotland, are encouraging. Next slide, please. Other ways to do with financial incentives is a ban on price discounts. We do not know too much about it. And so because there has not been that much research. However, we know that differential prices per unit of alcohol by beverage may work in specific cases. This is especially the case if a country is dominated by one beverage and the local culture is so strong that if you tax that, you overall decrease more. There's also some countries which have a tendency or a high rate on heavy episodic drinking, where taxing higher volume alcohol is actually preferential. Finally, the tax on youth-oriented beverages also has some evidence for effectiveness and can be used. So these are, in a nutshell, the financial incentives. Next slide, please. I'm now giving the summary. Overall, pricing and taxation is effective, and the most effective is alcohol taxation that decreases affordability. There are a number of other good practices, and you'll see them listed here. Next slide. I would like to go into nowadays and give some examples. We know that the theory should work, but does it really work? Next slide. This is very simple, the Ukraine, and we give the example on the sales volume and the real price. It is the usual nice mirror image of each other. So whenever the real price is going down, the sales is going up. If the real price is going up, the sales is going down. That means that sales of alcohol can be changed by government. And the main measure here is taxation. Next slide. These are two taxation decreases in Lithuania. I'm now going to a high income country. Ukraine was an upper middle income country. And you see in those countries, it works as well. There had been some arguments that taxation no longer works in high income countries. Just look at the red line. This was the example of Lithuania. They increased taxes by 100% for beer and wine, slightly more, and less for spirits. And overall, in 1 year, in a very small country like Lithuania, there were more than 1,000 deaths avoided. What do I mean when I say deaths avoided? Of course, we cannot avoid death. We will all die. However, they did not die in the 1 year after the taxation reform, but they died later. How do we know what amount of people would have died without the taxation? Well, we have a time series. We can do this time series analysis to predict what happens in the next 12 months and compare it to what actually happened after the taxation reform. This is one example, and you say, okay, 100% is not possible in my country. But what is more important, we studied all 13 taxation increases in 3 countries, Lithuania, Estonia, Latvia, and Poland, between the year 2000 and 2020. All of them, no exception. And on average, all-cause mortality went down by 2.3%. This is a lot of deaths avoided. And this is the average, which means taxation, despite being implemented at different times in different situations, and there may be other factors which were in favor, other factors which were against, but on average, it worked. And this is why it is so important to use this measure. Next slide. However, it not only is good for a country's health, it not only increases life expectancy, which is absolutely needed these days, because most European countries during COVID have lost life expectancy. Life expectancy in many countries has been going down in Europe. And this is what it actually could help increase again. But it also is a win-win situation. A country which implements taxation will gain revenue. And in the case of Lithuania, there were almost 100 million euros to the state in the following years. Next slide. What are the counter arguments against? Smuggling, cross-border shopping, unrecorded, untaxed alcohol will increase. This may happen, but it's by no means a clear consequence. It depends very much how you deal with taxation. In Lithuania, smuggling, cross-border shopping, unrecorded, untaxed alcohol did not increase. It will not work for alcohol. Well, there had been articles on that, and we actually, because we were curious, reanalyzed. It did work. We are currently doing a study on looking at all taxation increases in EU countries over 10 years to show that the revenue will be increased on average and in more than 8 out of 10 cases. And it will affect the poorest disproportionately. Well, prices going up. so the poor will suffer. Well, what we showed is that taxation increases were led to disproportionately high gains in poorer people in Lithuania. Actually, what Jakob, Mantai, and others could show for Lithuania is that this was the biggest boost to reduce the gap in mortality between the poor and the rich. So taxation should be structured to keep these points in mind. If countries like Belgium come to WHO and ask, what should we do to reduce our inequalities? Well, taxation of alcohol would be a good start. It does reduce inequalities, and that is also a very important characteristic. Next slide. So the conclusions are very simple. Taxation is probably the most powerful policy tool to reduce the disease burden of alcohol consumption, including but not limited to NCD, if it decreases affordability. Very clearly, you have to keep the mechanisms in mind. If inflation is 20% in a country and you increase alcohol prices by 5%, this is not effective. This is not decreasing affordability. And this is what some countries do. And this is what you see in articles in the media. Oh, it didn't work. We were told it will work. Well, it has to work. You have to look at the principles. Taxation is only effective if it decreases affordability. And also, what other conclusions do we have? We basically do have the rationale that we have the lowest taxation rates, the highest affordability in WHO European region, more than in poorer countries. This is crazy. And so even moderate increases in alcohol taxation, which reduce affordability, will have health gains. And we have made calculations, and you can read them in the Lancet Regional Health article, which is led by Maria Neufeld. Finally, there is a signature initiative. There is an initiative by WHO which to increase the tax rate, i.e. that more of the final price would go to countries, and this should be implemented. And WHO not only has this initiative, but will also help countries implement it. So if there are questions about how to best do this, please write to WHO.
We have some questions in the chat just before giving you the floor to both Ingeborg and to Jürgen, and maybe I would raise them already. Okay, so Jürgen and Ingeborg. So let's start with Jürgen. With you presented on the taxation. There are some questions for you. I guess the first one is about the common myth or a common idea, and I have here how to answer when people, even public health doctors, said that alcohol taxes would open the door to the black market. I think, Jürgen, you already raised the fact that many times we, even the tax increases are so small that they are not really effective. So not only they're not effective, they will never create a black market, but you also have some evidence about what happens when you increase the taxes, and you talked about that, about reducing the inequalities and about also having an important impact in the mortality in countries. But maybe you would like to say a little bit about the black market, and then just to say that there's also a question about, what kind of excise taxes should be used. I mean, is there a combination? Should we use a combination? And also, there's another question about the spirits. So I think all go to the black market, and what are the things that really are important when we consider increases of taxes? Thank you.
Okay, I'll try to be very brief. it's up to the country to open the door to the black market or not. There is no mechanism that automatically a black market will appear. What happened in some instances historically, that people increased taxes with an already large black market, and this black market increased because no countermeasures were being implemented. So it's up to the governments to actually implement those countermeasures. Countermeasures could be, for example, a registration system for all alcohol. When Russia implemented a big taxation increase, they also, in parallel, did do this registration and clamped down on the black market. I'm not saying that there's no black market in Russia now, but it is smaller than it was before. So Russia achieved A, an increase in taxation, B, an increase in revenue, and C, a downturn of the black market. So it will depend on the implementation. Second question, how do I best raise taxes? Again, this depends on the country. Give an example of Scotland. In Scotland, alcohol is very fluid, meaning heavy drinkers have been known to change their type of alcohol and their beverage type based on price. So you could see that heavy drinkers, if you would increase the tax on, let's say, cider, would switch to beer and vice versa. So in those situations, when there's a lot of fluidity between beverage types, you should always increase taxation across the board, but in a sense that the price increases for the consumer are the same for each 10 grams of pure alcohol, irrespective of what beverage you consume. This requires a little bit of calculation, but this is the right thing to do in those countries. There are countries where still 80% of the drinking is, let's say, spirits, and there you have to worry less about that, because for cultural reasons, the people will not switch to other beverages if spirits taxes are increased. And we have a lot of historical examples like that.
Thank you very much. So clear definition of the outcomes that we are looking for, and an analysis of what would be the best taxation and pricing policies that should be implemented. Ingeborg, so I have two questions for you. The first is, when you say that marketing bans cover social media, but it's probably circumvented, is it because there's no monitoring of social media marketing? And have there been fines or other sanctions on alcohol marketing in social media? And also, if in your view would make sense that advertising bans would cover those would be done with other actors, particularly those working on a ban on junk food, for example. So, bringing together the ban, not just for alcohol, but all harmful products. Yeah, thank you.
Thank you. With regard to social media and the circumvention, it's as I said, it's monitored both on the local and national level, and that applies also to the social media. And it's what they say at the National Directorate of Health, which monitors at the national level. They say that it is a problem. They don't know how big it is, and it's difficult to monitor. They don't have an overview of what happens at the local level, because we have more than 400 municipalities in Norway, so there's no overview of that. So And I'm not aware that there have been any sanctions with regard to breakage of the law regarding social media. I've asked the National Directorate of Health about it, and they are not aware of what has happened. I don't think they have had any sanctions in that regard, but it may have happened at the local level, but I'm not sure. With regard to whether a ban should be implemented together with a ban on junk food, for instance, I would assume that would depend on the country, whether policymakers find it easier to have a ban implemented, whether it's more feasible in a way. I would assume that it depends on each individual country, but it could make sense in some countries if it's easier to make an argument to have it implemented, if it's easier to monitor and to enforce the ban if it's the same authority. I don't think I have any additional comments to that. Thank you.
Thank you. Thank you very much. I think that we know how difficult it is to monitor measures, marketing, monitoring marketing measures in countries. And this has been long known that it's very difficult. And even when you have national authorities which are in charge, it takes so long to be able to take it out that, the market is won during the time that everybody is still discussing. So I think there's quite a lot of literature about this.
On this last point you were talking about, of course, it's not only alcohol that has this problem of dealing with social media, and for that matter, dealing with cross-border marketing. And there are things that can be learned from what countries have done about gambling, for instance, that can be applied to alcohol. So anyway, that's they're not perfect, but there are some solutions that, for instance, Australia has pursued.
Thank you very much, Robin. We had some conversations in the chat. There were quite a lot of questions asked and already answered in the Q&A. And in the interest of time, I would say, because I didn't see any specific questions to you in the chat, I would just say a big thank you to the three of you. And Robin, we're going to see you again on the 15th of June when we're going to discuss alcohol and the Sustainable Development Goals. And I suggest that we continue our conversation there. 15th of June between 10 and 11 again will be the next webinar. And I hope to see many of you there. And thank you very much to everyone.